Hi, this is Dr. Bharadwaz. I'm CEO and homeopathy doctor at Fidicus Homeopathy. Today we will discuss on one of the important topics, that is obsessive compulsive related disorders. So these are the group of disorders. We will see these disorders from the perspective of DSM-5. So DSM-5 is the diagnostic and statistical manual. If you want to diagnose a psychological disorder, you have to use this DSM, and it is also statistical manual. Classification system and diagnostic tool. You can classify the diseases. You can classify the mental disorders by using this system, and also you can diagnose both. It is a classification system and diagnostic tool. Okay, this is completely known as diagnostic and statistical manual of mental disorders. So who developed this? This is developed by American Psychiatrist Association. It is an association within America. It is located, its headquarters is located in Washington DC, USA. So they form an union. Who are the people that are included in this union? You have leading psychiatrists in this union. In the same way, you have researchers who will be researching on psychological disorders, and also academia. Academia means you will have students in it, or you will have professors in it, you will have lecturers in it, whoever are associated with psychology, psychiatry, and psychological disorders. Those formed an association in US. That association is American Psychological Association. They developed this DSM-5. Based on this, we will discuss what are the obsessive compulsive disorders. So current version is DSM-5. There are a lot of versions. Current version we are using is 2000 DSM-5. It is released in 2013, but there are additions to it, that those are known as DSM-5 TR 5th edition. We are the 5th edition of TR. TR means text review. So there are a lot of changes compared to DSM-5 TR has compared to DSM-5 which was released in 2013. DSM-5 TR 5th edition was released in March 2022. Okay, so there are many changes. These changes include lot of new disorders are added, or text is updated, diagnostic criteria is updated, and the link between DSM-5 and ICD-11 changes included in it. So for general disorders, for all the disorders we used ICD-11 latest version. For psychological disorders we use DSM-5. Even though ICD-11 includes psychological disorders, most of the practitioners use, or psychiatry doctors use DSM-5 because it is specific only to psychological disorders. It is more specific than compared to ICD. That's the reason most of the psychologists or psychiatrists use DSM-5 instead of DSM-11, but these can be linked with codes. There are different sections in DSM-5. There are 4 sections, but the important section is DSM section 2, because it contains diagnostic criteria and codes. That's the reason all the things which we are discussing further will be from section 2 of DSM-5, that is DSM-5 TR 5th edition. Next is obsessive compulsive and related disorders. These are included in second section, that is diagnostic criteria and codes. In that second section we are looking into chapter 6. Chapter 6 is for obsessive compulsive and related disorders. In DSM-5 we are looking into chapter 6. Chapter 6 gives the definition of obsessive compulsive and related disorder. What is that? Presence of obsessions and compulsions. In a person, if you have obsessions and compulsions, it is known as obsessive compulsive and related disorder. Then what is an obsession? Obsession is recurrent and persistent thoughts and urges or images. So when a person is thinking about something recurrently, persistently, it can be a thought or it can be a urge. Urge means to do something, impulse to do something, or images. Some images are recurrently coming into the person mind. That is known as obsession. Basically, obsession is thinking about the same thing, or remembering the same thing, or ruminating on the same thing, or urge to do the same thing, or impulse to do the same thing again and again comes under obsession. Then what is compulsion? Compulsion is a repetitive behavior or mental acts. If a person does the same thing again and again, for example, if a person is washing the hands again and again, maybe every 2 minutes, every 3 minutes, it is known as compulsion. And also mental acts. Mental acts means if the person is thinking about the same thing, or if the person is going to someone and asking about the same thing, it is known as mental act. See, you can see that behaviors and mental acts that are aimed to prevent uh, reducing anxiety and distress. Why the patient is doing all this? Why the patient is thinking and doing the same things? because there is a reason for it. When he does those things, what will happen? It prevents the or reduces the anxiety or distress. The patient will be anxious, or the patient will be in distress. To reduce the distress or to reduce the anxiety, what the patient does is he does repetitive behaviors. uh, where the anxiety is coming from? Anxiety is coming from recurrent and persistent thoughts and urges or images, and what he does, indulgence himself in the compulsion behaviors. These compulsion behavior, why he is doing that is to reduce the anxiety and distress. Distress is a severe form of anxiety, severe urge to do something. Distress means he is in a severe mental agony. You can consider it as a agony, or it is a severe form of anxiety. If the anxiety is at peak, we call it as distress, or we call it as agony. So these are the obsessive compulsive and related disorders. There are various obsessive compulsive and related disorders included in this chapter, that is chapter 6. First one is obsessive compulsive disorder. Second one is body dysmorphic disorder. Third one is hoarding disorder. Fifth one is trichotillomania or hair pulling disorder. Fifth one is excoriation disorder or skin picking disorder. And also there are other disorders. Next one is substance or medication induced obsessive compulsive disorder. Obsessive compulsive and related disorders due to another medical condition. Other specified obsessive compulsive and related disorders, and unspecified obsessive compulsive and related disorders. These are the various disorders included in this chapter. We will look into each and every disorder, and we will check how homeopathy can help you in this regard if any person has this disorder, and how homeopathy is beneficial to him than compared to other system of medicines. We will check into each and every disease now. First one is obsessive compulsive disorder. Obsessive compulsive disorder will have obsessions, will have compulsions. Why they have obsessions and compulsions? To reduce the anxiety or distress. Obsession is thinking about the same thing, remembering the same thing. It can be an image, or it can be a thought, or it can be a memory. If it is coming again and again, repeatedly, so unwantedly, repeatedly, then it is known as obsession. And coming to compulsions, compulsions are doing something to reduce the anxiety and to reduce the distress. Distress means severe form of anxiety or stress, you can say. To reduce the anxiety or stress, to get relief from anxiety or distress, this person is indulged in compulsions. Compulsions means doing something. For example, he gets the anxiety that the door is not locked, or his hands are not washed properly. He gets those thoughts again and again as obsessions. To come out of that anxiety, what he does is he will wash his hands or go and check whether he has locked the door again and again. So these are known as compulsions. If any person has these criteria, he can be labeled as obsessive compulsive disorder. Next one is body dysmorphic disorder. It is a preoccupation. So what happens in this is the patient thinks that he has a small defect somewhere in his body, physical defect, or sometimes it may not be defect. Sometimes it can be a minor defect, like a small pimple or small deviation on nose, small change in symmetry of the face, or something else which cannot be noticed by others unless they see very carefully, observe very carefully. Only then they can see this flaw or physical appearance, but it is not observable or not recognized by uh, slight appearance, or not observed by others. For this, he goes into distress or anxiety. He thinks and he goes into anxiety and distress. To come out of that anxiety and distress, he is indulged in some of the compulsive behaviors. What are those compulsive repetitive behaviors? Mirror checking. He always goes to the mirror and checks again and again. So excessive grooming. He goes, he puts makeup, or he grooms his hair again and again. He will be doing these kinds of things. And skin picking, because of this distress, what he will be doing is he will be pinching his skin, he will be pinching the lips. I have seen more people, or when they are in distress, what they do is they pinch the skin, especially on the lips. So lip pinching is most common among skin picking. Next one is reassurance seeking. They go to their loved ones, or they go to their peers, or they go to their family, and always check whether they are looking good or not. So they seek reassurance from their family or the person who are close to them. They can be mental acts. What are those mental acts? They are always comparing their appearance with the other people who are in their surrounding, or they can compare them with a particular hero or heroine. So mental acts is they always compare or they indulge in these kinds of repetitive behaviors like checking in mirror, excessive grooming, skin picking, reassurance seeking. They go to others and always try to impress them, or always try to seek their attention. These are all comes under body dysmorphic disorder. Hoarding disorder, this is a special type of obsessive compulsive and related disorders. What happens in this is the person is not able to part with their possessions. You can see some people, they will be piling up of everything in their house. If you go to their house, there is a lot of unwanted things in their house. They don't want to discard it, and also what they do is they get the discarded thing from outside and keep at home. So even though whether they are useful or whether they are not useful, they are not able to part with their actual things, or the things that are not valuable to them, or the things that are not useful to them. They will not throw it away, they will not give it, they will not sell it. They have a bond with them, and they will keep them with themselves. That is known as hoarding disorder. Next one is trichotillomania. Trichotillomania is a repeated pulling of hair resulting in hair loss. This is very important. When they pull the hair, it should result in the hair loss. That is the important criteria for that. Or repeatedly, when they are indulging in hair pulling, some people know about it, that they are pulling the hair, and they try to avoid it. Even hard trying or repeated attempts to decrease or stop hair pulling. So the person becomes conscious of hair pulling, and always he thinks about hair pulling, and he wants to stop the hair pulling, but unknowingly he again goes and pulls the hair. Whether to pull the hair repeatedly, going into hair loss, or if the person tries to stop hardly, not to pull the hair, even that is considered as trichotillomania. Trichotillomania, you see both extremes. One, they are pulling, and trying to stop the pulling of hair. Both comes under trichotillomania when the patient is in distress. When he is in distress or when he is in anxiety, tend to do these kinds of things. This is known as trichotillomania. Next one is excoriation or skin picking disorder. This is one of the common disorders. What they do is they recurrently try to pick the skin, resulting in skin lesions. Even they can be bleeding sometimes. So they try to pull the skin. And also, once they are indulging in that and they become conscious that they are repeatedly pulling their skin, what they do is they try to stop the picking of the skin. So even repeated attempts to stop the picking, they involuntary they start picking the skin, or repeatedly tries to stop the picking of the skin. It is also known as excoriation disorder. The most common place to pick the skin is lips. I have seen many people, including me. Sometimes what I do is I tend to pick the lips. So many people do that. This is most common disorder compared to all other obsessive compulsive and relative disorders. So picking of lips is the most common disorder among this. Next one is substance or medication induced obsessive compulsive and related disorders. So if you develop any compulsions and obsessions after taking a particular medication, after intoxicating, for if you are taking any medicine and intoxicating, especially best example can be alcohol. If you take alcohol and any other intoxicant material, and if you start getting these obsessions and compulsions, then that is known as substance or medication induced. And also substance withdrawal. You are taking a particular medication or particular drug or alcohol for a long time, and you have suddenly stopped it, and you went into these type of obsessions and compulsions due to substance withdrawal. And also exposure to medication. You are suffering with any disease, you went to a doctor and doctor gave some medication, you started obsessions and compulsions after taking that medicines as a side effect. That is also considered as substance or medication induced obsessive compulsive and related disorders. Basically you have to when you say that it is due to substance or medication, these three criteria should be satisfied. One is substance intoxication, or using a particular substance in higher quantity. Substance withdrawal, when you stop something suddenly that you are taking for a long time, or after the exposure to a new medication. You have started taking medication, and after that you develop this obsession and compulsions, then that is known as substance or medication induced obsessive compulsive and related disorders. Next one is obsessive compulsive and related disorders due to another medical condition. For example, I have seen these obsessions and compulsions in other disorders like Creutzfeldt-Jakob disease, or subacute sclerosing panencephalitis, Duchenne muscular dystrophy. So not only in psychological disorders or neurological disorders, you can see this obsessions and compulsions when there is other disorders which are not directly psychological. They can induce these type of obsession compulsions. Then it is known as obsessive compulsive and related disorders due to another medical condition. When you have another medical condition, because of this medical condition, or when this condition is due to the direct pathophysiological consequence of another medical condition, that is known as obsessive compulsive and related disorders due to another medical condition. This is also one of the common. Next one is other specified obsessive compulsive and related disorders. So when a patient goes to a doctor and doctor analyzes the patient, he thinks that it is OCD or obsessive compulsive disorder, but it does not fit into any of the previously mentioned disorders. So the symptoms are not complete, or the if it doesn't meet the criteria of the diagnosis, what doctor says is he give reasons. If he give, there are three reasons why XYZ. Doctor has given three reasons why he cannot include this patient, or why he cannot diagnose this patient as any of the previously discussed obsessive compulsive related disorders. Then he gives this as other specified obsessive compulsive and related disorders, because if he gives the reason, that becomes specified. Okay, this you have to keep in mind. There is a patient, he has obsession and compulsions, but it is not suiting any of the things that we discussed previously, or it is not meeting the diagnostic criteria of any of the previous disorders we discussed. Now doctor gives the reason. For reason 1 it is not suiting to diagnose, reason 2, reason 3, then it is specified obsessive compulsive and related disorders. When the same thing happens, patient comes to the doctor and he has obsession and compulsions, but doctor is not fully satisfied, or the disease is fully not matured, or the symptoms are not matching any of the previous diagnostic criteria. He mentions them as unspecified obsessive compulsive and related disorders when there are no reasons. The doctor is not able to identify, or doctor doesn't want to give the reason why this patient is not fitting into classical case of the diagnostic criteria of other diseases we have seen just before these slides. Then it is known as unspecified. It is unspecified if the doctor has not specified any reason why he has not put it into any of the criteria, but he is considered as OCD, but there are no complete symptoms without any specific reason. It cannot be qualified as disorder, but it has some symptoms here and there, but it is not classified as disorder, and the doctor did not give the reasons. Then it becomes unspecified obsessive compulsive and related disorder. Coming to the homeopathic treatment, homeopathy has the best treatment for any kind of obsessive compulsive and related disorders because of two things. What general people, or the people who have this disorder and going to an allopathic doctor or a psychiatrist or any system of medicine are afraid of is of two things. One is they are afraid of the side effects of the medication, and the next one is they are afraid of whether the disease is going to cure completely or not. These are the two things. Homeopathy, first one, homeopathy doesn't have side effect, especially in these kinds of disorders. We can treat the patient without any side effect. And not only that, homeopathy is highly efficient. There are very good medicines in homeopathy where you can cure the disease completely sometimes, or else reduce the symptoms. Sometimes you reduce the intensity of the symptoms, you reduce the duration of the symptoms, you reduce the frequency of the symptoms, and also you reduce the number of symptoms when we use homeopathy. The first aim to homeopathy doctor is completely cure it. If not possible, in some cases we can reduce the intensity, duration, frequency, and number of symptoms. With Fidicus Homeopathy, you have two types of treatment. One is online treatment and in-person treatment. Online treatment, you can consult us either audio or video of your choice. If you have any reports with you or any doctor notes with you, you can share with us. If anything else is needed, we will let you know. You can take that locally and send it back to us. Once we know your case completely, we will ship the medicines to your doorsteps. If it is in India, we will ship within 3 working days. If it is in US, it takes 4 working days. If any other country than US, it takes 5 working days. Or else, if you want to meet us in person, you can reach to our nearest branch. You can call this number. +91 is a country code, 7997 101 303. You can call this number, take the appointment, know about the nearest branch, and you can come to us. Then why Fidicus Homeopathy? Fidicus Homeopathy, with Fidicus Homeopathy, you have the highest chance of health. So you have the highest success rate with Fidicus Homeopathy. You will be given transparent treatment. They will not be obscuring anything from you. We will be telling you what is there in the disease, black and white, and you will get the personal care. That's the reason you have to consider Fidicus Homeopathy for any psychological disorder, especially OCDs. Thank you.